What is Naegleria fowleri? Naegleria fowleri is a thermophilic, heat-loving amoeba that can cause primary amoebic meningoencephalitis, PAM, a rare but often deadly brain infection. It's a free-living amoeba, meaning it doesn't require a host to survive, and is typically found in warm freshwater environments. 1. Lakes, especially those with warm water and low levels of chlorine or other disinfectants. 2. Rivers. Slow-moving or stagnant sections can harbor the amoeba. 3. Hot springs. Warm, mineral-rich water creates an ideal environment. 4. Swimming pools. Rarely, if the pool is poorly maintained or has inadequate chlorination. Life cycle. 1. Amoeboid trophozote, the active, feeding stage of the amoeba. 2. Cyst, a dormant, resistant stage that allows the amoeba to survive harsh conditions. 3. Flagellate, a temporary stage that facilitates movement. Infection and pathogenesis. 1. Entry. Contaminated water enters the nasal passages, allowing the amoeba to migrate to the brain via the olfactory nerve. 2. Adhesion. The amoeba adheres to the nasal mucosa and begins to migrate upward. 3. Invasion. The amoeba penetrates the cribriform plate and enters the brain. 4. Destruction. The amoeba feeds on brain tissue, causing extensive damage and inflammation. Symptoms. 1. Initial symptoms. 1 to 7 days after exposure: headache, fever, nausea, vomiting, confusion. 2. Progression. 3 to 7 days after initial symptoms: seizures, hallucinations, difficulty speaking, loss of coordination, increased intracranial pressure. 3. Advanced symptoms. Usually within 1 to 2 weeks after symptoms appear: coma, brain swelling, death. Diagnosis. 1. Clinical presentation. Suspicion based on symptoms and recent exposure to warm freshwater. 2. Imaging. CT or MRI scans may show signs of meningoencephalitis or brain abscesses. 3. Laboratory tests. Microscopic examination of cerebrospinal fluid, CSF, or PCR, polymerase chain reaction, testing. Treatment. 1. Miltefosine, an antiparasitic medication that has shown promise in treating PM. 2. Amphotericin B, an antifungal medication that may be used in combination with other treatments. 3. Aggressive supportive care, management of brain swelling, seizures, and other complications. Prevention. 1. Avoid warm freshwater, especially during peak summer months. 2. Use nose clips when swimming or diving in warm freshwater. 3. Avoid stirring up sediment when swimming in shallow water. 4. Use sterile or distilled water for nasal irrigation or rinsing. 5. Proper pool maintenance. Ensure adequate chlorination and maintenance of swimming pools. Key facts. 1. Rare but deadly. PAM is extremely rare, but mortality rates are high, around 97%. 2. Warm water. Amoeba thrives in warm water, above 25 degrees Celsius per 77 degrees Fahrenheit. 3. Prompt medical attention, essential for survival.